Just as sunflowers chase the sun, inductees into the South Dakota Hall of Fame chase their dreams day after day, year after year. The 700-plus inductees in the Hall of Fame come from all backgrounds and corners of our state. What their stories have in common is their unwavering courage and belief in their dreams. These dream chasers are an inspiration for us all to strive for excellence and believe in our own potential to chase dreams well into the future.
Dr. Rod Parry's profound impact on improving healthcare in South Dakota spanned more than 40 years as a physician-practitioner, scientist, teacher, and leader of medical organizations, including most notably the state's only medical school. As a physician, Dr. Parry distinguished himself for his skills, knowledge, and compassion. One of South Dakota's first pulmonologists, Dr. Parry's work on cystic fibrosis inspired him to help launch and direct South Dakota's Cystic Fibrosis Center. It was under Dr. Parry's leadership that USD's medical school established unique and beneficial educational programs that enabled the institution to become one of the nation's leading producers of rural physicians.
Hello, I'm Miles Beacom with the South Dakota Hall of Fame, and today I'm with Dr. Rod Parry, an inductee to the South Dakota Hall of Fame in 2018. Rod, thank you for joining us today. Could you start with just giving an overview of your childhood growing up and some of the challenges you had and where you grew up at?
Well, I'd be glad to. Yes, I've lived in South Dakota almost all of my life, and I was born on a farm, home delivery, in rural Canastota, South Dakota. And I went to grade school there, high school there, college at SDSU, and then to USD.
So no problem going from a class of 25 to the large classes at SDSU?
Well, I have to admit I was very nervous, extremely nervous. But again, if one has a focus and a goal, and I think even at that time and later on in my career, I developed a sense of needing to network. So you would network with some others that were going through the same thing or had the same goals in mind. And by networking with others, it just made the transitions easier.
When did you decide on a medical field?
Well, again, at the very last moment. It wouldn't happen now, I know. But at the very last moment, I decided I'm not ready to quit school. And so in April, I was going to graduate in May. I decided I would apply to USD School of Medicine. It was a 2-year school at that particular time. And I was invited for an interview. And the first question they asked me is whether or not I had comparative anatomy, meaning did you have a cat in your anatomy lab? Well, I didn't. And I may not have told the truth completely, but apparently they had an opening and I was accepted, and I'm so glad and so fortunate.
So that was a 2-year program.
It was a 2-year program at that time. South Dakota's medical school was established in 1907, and actually it had lots of challenges over the years, simply because it was a small school, funding was a challenge, and finding faculty was a challenge, but it was established because South Dakota was short of physicians, one of the worst in the nation at that time. And that remains a challenge for South Dakota. We need more physicians. The ones we have are just excellent, and I'm very proud of our medical care here. But the challenge remains.
When you were at Mayo doing your residency then, was that a tough decision for South Dakota then after that? Because a lot of times in residencies, they're able to hang on to their doctors.
Well, when I finished, it was 1976. At that time, South Dakota was just making the transition from a 2-year school to a 4-year school, and they desperately needed faculty. So I was recruited by Dr. Bob Talley to be the first pulmonologist in eastern South Dakota. And my job was to write the curriculum for lung medicine and to also provide care at the VA. But when I got here, I discovered that I was the only pulmonologist in Sioux Falls, so there were other opportunities and other requests at that time too. So it was a good time, and it was an easy transition. South Dakota then, and I think even now, is a very vast state, but it's also a state where you can be innovative and you have opportunities, and you can identify your own interest areas and take those interest areas forward and make huge contributions within those areas.
And so true and well said. Dr. Parry, what would you tell young people today going into the medical field? What words of encouragement or some intellect that you would share with them today?
There are so many opportunities in medicine. You don't have to be an MD to be successful. You could be a nurse, you could be a ward clerk, you could be a person who draws blood, you could be an ambulance paramedic. It doesn't really matter. If you're interested in helping people and making people's lives better, then there's a niche for medicine for you.
Very good. But when you were in Kansas, did you ever think that you'd be heading up the medical school for South Dakota?
Absolutely not.
And that's what kids have to remember today too, is just take it a step at a time, just as you stated earlier. And you know what, you don't know what life's going to do, but you have to go into it positive and work hard, and just as you have done. And the success that you've made and how you've changed South Dakota from the medical field to the medical school is just amazing. All I can say is thank you very much for everything you've done.
Thank you.